There's chronic underfunding in our healthcare services and our healthcare infrastructure, right? Now that chronic underfunding has two causes. I think that's the best way to see it. You have federal causes, that the federal government can do something to step in and solve that, and you have local causes. Now at the federal level, what we're seeing is a chronic underinvestment in Medicaid and Medicare here in Puerto Rico. And in an island where around 50% of the people use Medicaid, what you have is essentially just blatant discrimination against like half of the people in the island. And this obviously debilitates not only the care that they receive, but also the infrastructure that's serving these patients, these Medicaid patients. And that is a completely willful restriction to our Medicaid funds. This is just blatant discrimination, and this is something that can't be undone.
By the federal government.
By the federal government, yeah.
Giving less to Puerto Rico than they give to others.
Exactly, yeah. And in fact, if we were a state, for example, we would be receiving around 80% of our Medicaid expenses on behalf of the federal government.
Even the Virgin Islands gets more than Puerto Rico does.
Virgin Islands does get more in Medicaid and Medicare, if I'm not mistaken, yeah.
Right.
So definitely, there's this sort of patchwork, right? Yeah, this sort of patchwork where you have investment in some areas, and then some other areas they kind of just write it off. It's like, okay, you don't need to cover that service. So there's this lack of access to services because of that, because of this improper financing. So the federal government definitely needs to step in, provide that adequate, stable funding to our Medicaid and Medicare programs so that the people of Puerto Rico have that healthcare coverage.
But how does this affect all of you who want to be the next generation of doctors?
At the end of the day, we want to stay here, right? We want to practice in Puerto Rico. The vast majority of us are, from here. We were born and raised here. I was born and raised here too, and we don't want to leave, right? But there are local issues, right? Which I think this is a good opportunity to discuss them. There are local issues that force us to leave sometimes. Around 400 medical students graduate, but only 200 residency positions are available, more or less. So 200 medical students need to leave to the United States in order to finish their training over there, and then here in Puerto Rico we're left with a smaller amount of physicians. And out of those that graduate from residency training here in the island, then you have those that will eventually leave because of the very low tariffs, the very low payments that they're going to receive here in Puerto Rico.
Give me the payments of what a doctor makes here compared to a doctor in Florida where somebody might go to work.
I can't give you those numbers off the top of my head, right? Okay. I know they are readily available. Something that I do know is that Medicare is usually one of the lowest payers in the United States, but here in Puerto Rico, Medicare is actually the best payer out of all of the healthcare coverages available on the island. So that sort of gives you like an idea of where we are. The worst payer in the United States is the best payer here in Puerto Rico. So the main reason here is that yes, a lot of doctors want to stay here, but there comes a point where the bureaucracy, just the constant challenges that they face with the health insurance companies here in the island, where they don't get paid on time. They are legally mandated to pay in certain time frames, and they just don't meet those requirements. Because at the end of the day, we're talking about an entire generation of doctors, right, future doctors, that are concerned about the state of the career here and the state of the health. We're concerned about the way our patients or future patients are being treated. So we want to stay here, but we look at the conditions around us, the things that doctors tell us, our own professors, family members that may be in medicine. We hear constantly about the problems that are facing the island, and just within 3 years, we might have to make that fateful decision where we either stay or we leave, and it's not entirely under our control.
Show of hands, who wants to stay and work here? Put your hand down if you think you might have to leave. All of y'all? Wow.
50-50 chance,
Wow.
It's not up to us.
Wow. Okay. Yep. All right.
Recently, news came out that the government is going to be adjusting payments for the Medicaid program because they operate under the assumption that the main problem here is the fact that physicians are leaving.
Right.
While we know that is just a symptom of the underlying disease. The underlying disease being the control that health insurance companies have. So while the proposals are good, right? They present a good step in the right direction. We don't need more temporary reprieves. We need permanent solutions to these problems. And these are not permanent solutions that are being put forward. Now, I applaud these efforts to try and get us moving in the right direction, but we need more drastic action. If we don't take action right now, things are only going to get worse in the
At
future.
a very simple level, a very easy to understand level, what are insurance companies doing that you see problematic?
if you believe in fiscal responsibility, the use of taxes appropriately, then you should recognize that the current system is structured in a completely incorrect way. You have so much waste, administrative waste within these healthcare plans. A lot of money doesn't go to the patient, and that's the problem. While you see like record profits for health insurance companies, you're seeing patients constantly being denied care here in Puerto Rico. So you got to ask yourself, if they're doing so well financially, then why are physicians leaving the island because of payments? If those companies are doing so well financially, why do doctors have to leave? Why are the patients not receiving the healthcare services that they need?
Now, some of the comments, and there have only been a few, but I didn't expect, a couple of people were like, well, they're just greedy. These are just greedy kids or greedy doctors. What would you say to that?
It's not about greed. And anybody that sees the reality here in Puerto Rico, that sees patients, that has interacted or been a patient themselves, they know that the healthcare services here have been in a perpetual decline for a while now.
Yeah.
That's just the reality.
Yeah.
Anybody that's trying to portray a different picture is either doing it on purpose or they're completely delusional as to the reality that people are living here in Puerto Rico.